The following program is a Town of Colonie television production of the William K. Sanford Town Library.
Hello everyone and welcome to Young at Heart. My name is Tom Scarff from the Albany County Department for Aging, and this is being taped a few days before we have a major stakeholders meeting for the age-friendly Albany County initiative that I was telling you about, I think on the last program. It's a major initiative that is sponsored by the World Health Organization and the National AARP. Albany County and County Executive Dan McCoy was accepted into this program back in October of last year. And it's an exciting program. It's about a 5-year initiative, and we're looking forward to giving you more information as time goes on. So you can stay tuned for that. If you have any questions, you can contact us at agefriendlyalbanycounty.ny.gov. agefriendlyalbanycounty.ny.gov, and I'm sure that our producer and director Greg will put that up on the program next week when you see this on the air. Today we're going to be talking about an issue that is of vital importance to seniors, but not just seniors, to family members also. It's something that we need to talk about and have a good, hard discussion, because it seems as though there are certain levels of mental health problems among our older generation, and some drug addiction among our older generation, and some young people that affects grandparents and parents. So my guest today is the director of the Albany County Department of Mental Health, Dr. Stephen Giordano. Doctor, welcome.
Thank you, Tom.
It's great to have you here.
Pleasure to be here.
How long have you been with the department?
I've been with the Albany County Department of Mental Health for just about 30 years.
Oh my God, really?
Yes, I've been the commissioner for 6.
Okay, and before that you were the assistant commissioner or deputy?
I held a lot of positions. I started out as a staff psychologist. I worked in our addictions program, and I was the quality assurance director. Then I was associate director, and just kept.
30 years is a long time.
Yes, it is. I think that makes me a senior.
Well, it does, but it also makes you a person who obviously enjoys your work.
Yeah.
And brings the best of everything, as far as I'm concerned, and I know that the county executive shares this opinion that you do a phenomenal job down at the mental health department with so many things that are going on, like the.
It's kind of you to say.
Well, it's absolutely true. Now, there's a new concept in mental health that you were talking about at a meeting that I was at, and that's where the health homes, is it called?
Yes.
And what exactly is that?
Well, health homes is a concept, not a place.
Okay.
And it's part of the governor's Medicaid redesign initiative that goes back to 2011, I think. And it was an effort to redesign the system so that people with chronic illnesses received what we're calling care managers to help them navigate the system of care, which can be very complicated. And so there's a menu of disorders that would make someone eligible, but they're mostly chronic physical conditions and mental health and addiction issues that would allow you to get this service.
So it used to be that there were places that you could go to get mental health and addiction treatment. And it was kind of like, people were falling between the cracks, and they started the programs so that they could combine the two. But this also takes into effect the physical condition also.
Yes, it does. And the care managers themselves are not the treating professionals. They're the people who are helping folks who might otherwise not be able to connect to the services they need to get them. So they're really kind of like the navigators. Case managers is what we used to call them. Now we're calling them care managers.
I know the Department for Aging often gets phone calls from concerned family members or friends about a problem that they foresee as either being forgetful, or a lot of people, you know, think because an older person forgets things that it's the beginning of dementia or Alzheimer's. And sometimes it's just not true. But if somebody has that type of a concern, it's not easy to get a psychologist to see somebody immediately. And I find that a lot of family members and caregivers want that immediate service. What do they do? There's really nothing they can do, is there?
Well,
expedite it?
I never like to say nothing, because I think there's always hope for our citizens in these regards. The issues are complicated, and some of the conditions that you mentioned mimic each other or correspond at the same time with each other. So it becomes a very important issue of how do you assess what's actually going on. So my recommendation has always been to work with a primary care physician first, because the three things that I'm most aware of that can coexist are mental health problems, substance abuse problems, and neurological problems. And sometimes they happen at the same time. You could have dementia and depression. Sometimes dementia looks like depression. Sometimes depression looks like dementia. And it's very important. I'm a psychologist, but I recognize the importance of the physical health component. It's a great interrelation between the two. And I always recommend start with your primary care physician. Let's get a sense of what's going on physically. Rule that out before we assume that it's a mental health problem. So, you know, the first recommendation would be to work with the medical professionals in your life. They may say it's not physical, and that you need to reach out. And then I think your point is well taken. There is not a recognized cadre of senior specialists in our community. And we've talked about that before, and we're actually working on trying to develop a list of...
It's pretty much statewide, right?
Oh, it is definitely statewide. It is one of the things, in anticipation of speaking with you this morning, I was thinking if I could change the system, it would be to start in our education process. Social workers, psychologists, nurses, psychiatrists, all of those folks take courses maybe in senior issues, but I'm not sure that there's a adequate opportunity to specialize. And it is a specialty area. And we know the aging population is growing exponentially.
Well, absolutely. Well, Albany County right now is probably around 23% of our population. And
Above 60, you think?
Above 60. 2010 census said that it was 20%. There were about 63,000 seniors. And we are anticipating that in the next census, which is coming up in just 3 years, it'll probably be closer to 25%.
Well, the good news is people are living longer.
People are living longer.
But with longer life comes more challenges.
Right. And a question that I think a lot of our viewers will have is dementia and Alzheimer's the same thing?
Dementia is kind of like an overarching concept. Alzheimer's is one form of dementia. And as last I checked, there were probably 7 or 10 types of dementia. Alzheimer's is one of the more common. And so it is an aspect or one type of dementia.
But a lot of people will say, my parent or my grandparent or my mother or father is in dementia.
Yeah.
And it's not always necessarily true.
Well, you know, it's like when people say I had the flu.
Yeah.
And they said, did you really have the flu? I think this is where that kind of specialty assessment is important, because there are physical correlates that need to be identified early, the earlier the better. That's where you start with your physician. But there are neurological aspects which mark Alzheimer's versus others. And of course, there's things going on in the brain that can be pinpointed if diagnostically. But I think it's used in common parlance, misused in common parlance often. There are age-related memory problems that probably you and I would admit that we've experienced.
Absolutely.
And that's just like, you know, your muscles hurt, and as you age, all kinds of things happen, but they're not necessarily pathological. Right. They're normal. and people experience mild cognitive impairment, which is actually a condition that's identified. It's a little bit more challenging to people than normal age-related memory and cognitive problems, but it's not yet interfering with their daily functioning. And then there are the different dementias. Alzheimer's is one, and Alzheimer's, we've probably met people who have it. It's a very devastating illness, and you mentioned caregivers. It's very stressful for the family and loved ones and caregivers as well.
Which is something that we kind of tackle in the Department for Aging, because we actually fund some people that will do respite.
Yeah.
Agencies that will actually do respite programs, have respite programs where they will come in and give you a break. If you need to get away, if you need to go out to dinner or go to a movie or something like that and you haven't been able to. If you call 447-7177, that is the New York Connects line, and they can tell you all of the respite programs in Albany County and what they provide. And a lot of them are free. So you might want to do that if you are a caregiver, because it can be devastating to caregivers sometimes if they can't get away.
Absolutely. And also, Tom, there are, and I think you can get this information through the number you just gave, there are support groups for Alzheimer's. There's support groups for all kinds of physical and mental health and addiction problems that people can connect with and learn that they're not the only ones experiencing that.
Is it an epidemic? Because some people say it's an epidemic.
Which?
The Alzheimer's.
I know that it afflicts women about twice the rate of men. I know that there are great efforts all around the world trying to identify the earliest signs to try to either minimize the progression or stop the disease. I can't say whether we're finding more of it because we're better at assessing it or whether it's actually more developing. There are certain genetic predispositions.
Oh, there are?
Oh, yeah.
I was wondering about that.
And you can, actually there are some people who argue that if we all took advantage of the advances in genetics and got our genotypes done, we might be able to start to identify the early markers before symptoms develop. And I don't think you can change your biological makeup, but you might be able to live your life in a way that can offset some of the damage. The ultimate remedy to all of these things is what we've all known as, living a healthy lifestyle as best you can, and socializing and getting exercise and eating right, and whatever condition you're facing, you're going to be better off and stronger to fight it off. But Alzheimer's is not something that you can't cure it.
Right.
It's a pretty devastating degenerative.
Can you control it at all, or put off the inevitable?
Yeah, I think that there are many people who are receiving different types of experimental treatment for Alzheimer's. I'm not sure what the ultimate effectiveness of them are.
I was wondering, you mentioned around the world, and our partner in age-friendly Albany County is indeed the World Health Organization.
Yeah.
And the American Association, now it's no longer retired people, it's Real Possibilities. AARP is no longer for retired people because they're taking people in at 50 years old.
Yeah.
So it's the American Association of Real Possibilities. But the World Health Organization is very concerned about the increase in the aging population, and the various mental health problems that they see coming up. Now, we've just tackled one, which is dementia. But there's also, I know there's a task force, I think, in the town of Colonie that will work on the problem of hoarding. And what do you know about that? I mean, is that a mental health issue?
I've been part of some of the early discussions of that group, and we are trying to partner with local educational institutions and with the town of Colonie. And it's certainly something that afflicts many people, and it is damaging to their lives. I don't know that we would call it necessarily in and of itself a mental health condition, but it's symptomatic. It's a compulsive behavior.
Oh, it is.
It's a
Right.
anxiety-reducing behavior. All of those conditions are probably coexisting with people. That's a behavior that reflects some other kind of internal problem. So depending on the person, there could be a number of different conditions. But it seems to be, unfortunately, they've made TV shows about it, and you see the worst cases. But I've talked to some of the Colonie officials, and the county has been in homes in this area that you can't open the door. And it becomes not only a psychological challenge, but a public health issue.
It is a health issue.
Of course.
And it's also a safety issue because
And a safety issue.
People fall. If they can't walk through their homes, they fall and they break bones, and it's not a pleasant thing to run into. And a lot of children talk about the parents and how the house is just completely a mess, but they can't get the parent to remove any of the debris.
Well, I think that so far the government has the ability to only take charge when some residence is condemned for a health or safety issue. And at that point, we've talked in this group that you mentioned of situations where the homes will be emptied, but without the follow-up mental health care, which I think you're correct in saying is necessary. The people just repeat the pattern. So a year later, we're back to where we were. So what this group is talking about is how do you identify people who understand this issue, and it's not just an aging issue, by the way, but it is certainly prevalent in the aging population. But how do you get in there afterwards, after you've cleaned the house out, to work with folks to understand what that all was?
Is it a result of depression, do you think?
Well, I think it can be symptomatic of depression, sure. I mean, you could try to interpret it, I guess, in many different ways, but clearly people are having a hard time letting go of things.
Memories a lot of times, I would imagine.
Well, memories, sure. And there's so much loss that accompanies the aging process. You might just say that this is one way to unsuccessfully counter what's really happening, which is every day you're losing things.
Now, we talk about depression, and I think sometimes loss of a loved one, for instance. A person goes into mourning for a certain period of time, the stages of the mourning that Kubler-Ross wrote about. And, she talks about it being a natural progression a lot of times.
Grieving,
right. But some people, again, family members or caregivers, feel that it's depression. It's not necessarily depression. I mean, it might be a temporary situational thing, but a lot of people come out of it, no? Oh,
absolutely. We even talk about this diagnostically in terms of complicated and uncomplicated grieving. It's never not painful, but there usually is a trajectory that can be identified, and at some point, I don't know that you'd ever say the loss is forgotten or its effects forgotten, but people return to their normal functioning level. Some people don't, and that's for a variety of reasons. There could have been depression to begin with. It could have triggered a depression, which then is a separate issue from grieving. They look the same, though. Sadness, for example, is a marker for both. But grieving is a normal process, and if you talk to people who are in the grieving process, they will tell you there's no timetable for it. And I think some people who haven't gone through that don't understand that, and it's like, okay, already, aren't you over this? When are you going to be over this? And then they might make an erroneous judgment. Well, there must be something wrong with them. But I do think that people who are grieving also need to take advantage of support and professionals when necessary to make that determination. But grieving is not depression.
Okay. All right. Well, County Executive McCoy, I want to talk about opiates and drug addiction among older people and everybody. County Executive McCoy is the first vice president of the County Executives of America.
Yeah.
And has just been named chairman of the Opioid Task Force on the national level,
Yeah.
along with the county executive from St. George's County in
Yeah, it's
Maryland.
incredible.
It is. It's great. How prevalent is it? I mean, now people seem to be getting on the pharmaceutical companies, but it occurs to me that if a doctor didn't prescribe it, the patient wouldn't get it.
Boy, this is a lot to say there. I talk about this a lot in my daily work. The issue, well, there's a couple of issues here. One is addiction, and it doesn't have to be just to opiates. We have agency in Albany County, Senior Hope,
Right.
the first in the state, and it might be still one of the only in the state that has dedicated itself to treating addiction issues in the senior population. Interestingly, they've moved their eligibility down from 60 to 50, and they might even be...
Does that include alcoholism?
Oh, absolutely.
Okay.
Absolutely. And I think that not to minimize the opiate problem, but I think it's a mistake to suddenly say opiates is a problem that's come out of nowhere. The issue is addiction, and people who abuse alcohol are 2 times more likely to have opiate addiction problems. People who abuse marijuana, 3 times more likely. Cocaine, 15 more times likely. Prescription medication, 40 times more likely. But there's all of these things are connected. So I don't think we should separate opiates from the problem of addiction in general. But the current situation with opiates is very severe. And you're also right to identify the connection to the medications. 4 out of 5 folks who are addicted to heroin and other opiates today, we believe 4 out of 5 started with prescription medications. Doesn't mean it was prescribed to them, because there's a whole illicit use of prescription medication. Exactly. And we were just talking last night with the county legislature about this. We all probably have in our medicine cabinet old prescriptions of medication, pain medication that we were prescribed. But when our sons' friends come into the house and use our bathroom and take the medication and give it to all their friends, and we don't know that it's missing, and they're using those drugs illicitly. It wasn't prescribed to them. But the damage and the potential for addiction, it remains. So yes, we do believe that the pharmaceutical company had some role in all of this, overprescribing over the years, and there's some changes in that. Guidelines for physicians to prescribe more responsibly. But the fact of the matter is, it is an epidemic, and we've never seen anything like this right now. And it's an equal opportunity employer. The seniors are not excluded from this.
Well, I had some people here from the Center for Problem Gambling.
Oh,
not too long
yeah,
ago.
sure.
Actually, I think it was one of our first programs, Young at Heart, and they were talking about gambling addiction among seniors.
Yeah.
That it starts off maybe sometimes as a social activity. They go into an OTB or something like that and have coffee with their friends, and it ends up to be a real serious problem because their Social Security checks and retirement, sometimes their mortgage is gone. What do you see? Are you seeing an upsurge in that at all?
Yes. We work closely with the Center for Problem Gambling, and the science is showing us something very interesting. The brain responds the same to opiates, to alcohol, to cocaine, to gambling, to compulsive sexual behavior, to compulsive shopping, eating, and stimulating, in this case, dopamine, which is part of the brain's reward system. And people who are compulsive gamblers talk about their gambling in the same way that people talk about their drug.
About the rush and everything else. Yeah.
And years ago, when I first learned about this more hidden problem of gambling, someone said, listen, I could come to you and give a presentation on, if I came to your place of work and gave a talk at lunchtime and I had drank all morning, everyone in the room would smell it and you'd think, but if I had gambled away my son's college education on my way to this meeting, no one would ever have known it.
Well, it's not just that, and I believe in giving credit where credit's due and also blaming where blame is due.
Yeah.
And I think the state of New York, not only the state of New York, but a lot of states, $1 in a dream is actually a nightmare for a lot of people.
I think you're so right.
You know, I mean, you can't drive and drink. You get arrested. You can get arrested. Can't buy illegal drugs. You can get arrested. But you can. The state now with legalized gambling, coming even further, they're saying it's going to be sports betting and everything else eventually.
It is indeed a double message that we give our citizens. And again, the folks at the Center for Problem Gambling, we've talked about this. The research is pretty clear. When you put a casino in an area, and it accrues all of the financial gains that the media is talking about, but suicides go up, addiction goes up,
Divorces.
all of those issues. But as a society, we're talking out of two sides of our mouth on that, and I think in anticipation of the casino opening, people in the profession were getting calls from gamblers who were starting to get anxious. Before this opened up, they knew that they'd have to drive 2 or 3 hours to do it, and that they felt safer. Mm-hmm. Now they could do it on the way to work, and it was scaring them. And so I missed that show, and I always tell you I enjoy your shows, but I don't know if you've archived that one, but I'd like to see that. They provide a great service to the community, and as with drug addiction with seniors, it goes under the radar. And I think we minimize it, we misdiagnose it, we deny it. Mm-hmm.
I mean, it's a horrible addiction that is promoted rather than stopped. And I also noticed
we don't ask people about it as part of our workup.
And I also noticed that there is a very, very small amount of money that went into treatment when this gambling bill passed the legislature. I think there's only 2 or 3 residential facilities in the state of New York. One of them is in South Oaks Hospital down in Amityville. Mm-hmm. And I have a friend that called and said this was because insurance didn't cover it. Mm-hmm. So he called and said, how much is it? And she said $25,000. And he said, if I had $25,000, I'd place it on an Exacta, not on treatment.
That's crazy.
And it's a tough disease, and a lot of people don't even think about it when they think about addictions. And like I said, $1 in a dream can certainly turn into a nightmare for a lot of people, unfortunately. Well, Steve, we're almost at the end of time, and I could talk to you for another 2 hours about things.
Invite me back.
I absolutely will. It was a wonderful discussion, and there's so many other areas that we need to address concerning seniors. Senior Hope is a great asset and a great resource for people.
They are.
And again, if you call 447-7177, they would be happy to talk to you about Senior Hope that deals with addictions. Not just for seniors now, because it goes down to the age of 50, and hopefully at some point it'll go even lower than that. So.
But what we've learned is that people, seniors, do better in addiction treatment with peers.
Oh, absolutely.
And that was the main insight of this program, and that's what they do for us in the community. And
it's a great organization, and it's partially funded by the Albany County Department for Aging and New York State Office for Aging. So, Steve, I want to thank you very much. Dr. Stephen Giordano, the Director of the Albany County Mental Health Department, and I want to thank you for watching us and invite you to join us once again next month on Young at Heart.